Okay, in this video, I'm going to be talking mostly about the psoas major and in conjunction with the Quadratus lumborum, or the QL, which most people know it as, and how important it is to understand this complex. And I feel like the psoas major is villainized a lot of the times when it comes to, oh, you shouldn't be recruiting your hip flexors, this and that, but should we or should we not is really the question. So let's look at the direct links. We have fibers that innervate right into the vertebral bodies right here. And if you look carefully, they have a direct link into the intervertebral discs, okay? So within that disc, there are called the annular rings, and there's a nucleus, which is in between each one of these, and that's the liquid. That's where a majority of the pressure goes, especially inside band rotation in the gall swing, okay? And so this deals with a lot of lateral flexion and stability. So when you're at impact and you're ready to hit that ball, this is really one of the prime stabilizers for these guys right here, okay? And it has a very powerful lever, and it goes all the way down into the lesser trochanter, which is a part of your, the femur, which is a part of your, just call it the leg bone, okay? So making sure that you're reinforcing these muscles here, the quadratus lumborum. As you can see, it also attaches to the vertebrae through the transverse process, which are these guys right here, okay? These bony landmarks right here. Has an attachment to the top of the ilium and also the 12th rib, which is a folding rib. So this can cause, if it's very tight on one side comparison to the other, it can cause a lot of this excessive side bending, and that is not great for these guys. Remember, back pain is a physics and geometry issue, okay? And so we must respect all the small things that are going in conjunction with the lower spine, so that we're not 30 years old and need back surgery, okay? We can get away with it for a long time. I do have clients that are as young as 20 years old and clients that are as old as 85. And believe me when I tell you, if you're not paying attention to some of this stuff and adjusting your training accordingly for longevity, you can cause some problems. So you can tie maybe an ankle weight to your ankles and bring your knee to your chest, and while fixing the pelvis, making sure the pelvis is immovable, and that can create some strength around this complex right here. Also with a nice stretching routine. And hopefully some of this helped and brought you some insight on, what's going on with the lower back. Because remember, it is a global system. You don't have a back pain problem, you have a back pain symptom. Share this with somebody who is suffering from back pain and may need some education of what's going on.